Hey, before we get started with today's presentation, I would like to thank you for taking the time to join us. And I would like to recognize the funders of Cochrane Canada, without whom these webinars, our training, systematic reviews, and capacity building could not happen. Thank you to CIHR and their institutes for their support. We would like to also acknowledge the Ontario Ministry of Health and Long-Term Care for their support. In addition, I'd like to thank PAHO, or the Pan American Health Organization, for kindly providing the software for our webinars, and a special thank you to Dr. Luis Gabriel Cuervo, who converts our webinars into YouTube videos. Well, without further ado, I'd like to welcome the first of 5 monthly policy-related webinars that will be taking place. I would now like to introduce today's presenter, Dr. Kaelan Moat. Dr. Moat is currently lead at Health Systems Evidence and Learning at the McMaster Health Forum, and is also part-time faculty member in the Department of Clinical Epidemiology and Biostatistics at McMaster University. His research focuses on how to support the use of research evidence in health systems policymaking, with a particular focus on both the evaluation of innovative mechanisms designed to increase the likelihood that research will be used to inform policy decisions, and on better understanding the influence that political factors have on these mechanisms and their use. Dr. Moat holds a Master's of Science in International Health Policy from the London School of Economics and Political Science in the UK, and a PhD in Health Policy from McMaster University. Kaelan, thank you for being with us today, and I will now hand the presentation over to you.
So thank you very much, Eileen. It's my pleasure to be here, and on behalf of the forum, I'd like to thank Cochrane Canada for providing us with the opportunity to present what will be an overview of the 5 core programs the forum has going. I'll be focusing on one of those core programs, which is Health Systems Evidence, and be providing with a background about what it is, and a general background about the usefulness of one-stop shops. How we develop the database will also be addressed, what's in the database now, but I'd like to focus the majority of my attention today on demonstrations using some policy relevant examples. And this is just to get people comfortable with the main features of health systems evidence, how to register for it, how to make the most of the advanced search function, and I'll get to that later about why that, I think anyways, it's a benefit to use the advanced search function. So as I mentioned, a bit of rationale for one-stop shops, which are being referred to on our end of things these days as a self-serve knowledge translation innovation. And this is because we do our best to put everything in one place, but at the end of the day, it's up to people, policymakers, stakeholders, and researchers to use the resource as they see fit. So it's a self-serve innovation. This type of one-stop shop is particularly important and promising because it can support timely access to research information, and this is because they afford you the opportunity to provide everything in a single place. By facilitating assessments of relevance, it's also a beneficial tool, and this can be achieved by organizing based on priority topics. So in our case, we organize all the records based on health systems arrangements, but if you're interested in public health, you might want to organize all of your documents by particular diseases or interventions of interest, so mass media campaigns versus health promotion in primary care clinics. So those might be different ways you might organize something in the public health domain. You can also provide decision-relevant information in one-stop shops in a way that places like PubMed, for example, doesn't do. And for example, you could provide quality assessments of all included systematic reviews, or the countries that are the focus of documents, or that are the focus of included studies in systematic reviews. By presenting all of the evidence in several formats in ways that are user-friendly, one-stop shops also provide the opportunity for people to enhance communication between the research world and the decision-making world. And this can be achieved by providing the range of different formats of a single systematic review, for example, links to user-friendly summaries, or free full text when they're freely available. So at this time, there are several good examples. I've highlighted three that are kind of the ones that we go to as the illustrative examples that exist. So if your questions are about clinical program services and drugs, or as we like to call it, My Health, the Cochrane Library is still the best place to go for those types of questions. If you're interested in questions about public health and community health, you might be asking questions about our health, and then health evidence, which is also located here at McMaster University, would be the place to go for these types of questions. If your question is about health systems arrangements and how we organize our system to get cost-effective program services and drugs to those who need them, or questions that address our system, then health systems evidence, or as I'll refer to now as HSE, is the place to go for these types of questions. So health systems evidence currently is the world's most comprehensive free access point for syntheses of research evidence, as well as a range of other types of documents that address health systems arrangements. And health systems arrangements include all of those governance, financial, and delivery arrangements within health systems, as well as implementation strategies that can support change in health systems. So an example of a governance arrangement might be regionalization versus centralization. An example of a financial arrangement could be whether we pay doctors with capitation or fee-for-service. And an example of the delivery arrangement would be whether or not we choose doctors as the sole provider of care in primary care organizations, or whether we shift some of those tasks to nurse practitioners. Implementation strategies are those efforts that can support change. So when a policy decision is already made, what types of things might we consider when we're trying to implement this change? So examples of these might be providing consumers or healthcare patients with the adequate information they require about a new policy decision or a new program that exists. We also might focus on the provider end of things and do things like audit and feedback, which many people on this webinar are probably quite familiar with. So health systems evidence organizes all of the documents, including all of the syntheses and systematic reviews, by this extensive taxonomy, which covers these domains. Currently, there are 9 document types in the database, and this includes evidence briefs for policy, which are a relatively new approach to research synthesis, which tend to start with a priority policy issue and then work to identify the range of global evidence from systematic reviews as well as local evidence from single studies to address a priority policy problem, to help come to grips with what types of options might be available to address the problem, as well as the implementation strategies. Health systems evidence also contains the full range of overviews of systematic reviews of effects, systematic reviews addressing other types of questions, which can include reviews of observational studies and reviews of qualitative studies, systematic reviews being planned or systematic review titles as they're registered, systematic review protocols, economic evaluations, health system descriptions, which are descriptions prepared mostly at this point by the European Observatory for Health Systems, and these are descriptions of the full range of factors that make up the health system and the characteristics that make up health systems. It also includes economic evaluations. So there's also a lot of value-added content to the range of records contained in health systems evidence, including quality appraisal. So every systematic review in the database has an MSTAR score. The last year, the literature research is also highlighted for users. Links to any user-friendly summaries are identified, as well as links to abstracts and full text when freely available. They're also now increasingly, I think we're at 85% now with links to single studies included within particular systematic reviews, and these are organized by countries in which these single studies were conducted. And as I mentioned a few times now, there are many different ways to limit the searches, and this includes the full range of taxonomy categories as well as particular domains of interest, which can include things like the different healthcare sectors you might be interested in, primary care versus long-term care, as well as particular topic or disease domains, so whether you're focused on the cancer sector or whether you're focused on mental health questions. The full database is available and searchable in all 7 official WHO languages, and there's also a monthly customizable evidence service that can prompt you with new content in your domains of interest once you choose. So I'll get to how to sign up for that in a minute. There are also 3 additional portals which contain policy-relevant documents. So these are all of the non-research type inputs that policymakers, stakeholders, and researchers might consider when thinking about problem, options, or implementation. So we have the Intergovernmental Organizations document, Health Systems Documents portal, which contains a full range of documents prepared by international organizations such as the WHO. We also have Canada's specific documents in the EIHR portal, and Ontario-specific documents in the OHSD portal. So now getting to our first poll question, I'm just interested to know how many people here have heard about HSE. So this is a yes or no question, and you can answer either yes or no. Great, so it looks like the majority of people have heard of health systems evidence, but another good thing is that some people haven't. So hopefully what I'm presenting today will be a little bit different from what you've seen in the past, because I'll be focusing mostly on search. But also for those who are new to the database, you'll be able to see whether some of these features will be useful in the searches you'd conduct in your day-to-day work. So the second question, for those who have heard of health systems evidence, how many have used it in the past 6 months? Okay, great. It looks like of those who have heard of it, so it's about an even split, but more people haven't than have. So hopefully today I can show you some of the advanced features that would make it more useful, and for those who haven't, or so for those who have used it, hopefully what I'm presenting today will show you things you didn't know before and help you optimize your searching. So just a quick background before I get into some of the demonstrations how health systems evidence was developed. It was developed beginning, I think, 2007, but this has been an ongoing process and is still ongoing. We're constantly trying to make improvements to the search functionality as well as the content. But the original source of systematic reviews was identified through electronic searches of several databases, including Medline, Cochrane, the database of abstract of reviews of effects at York University, McMaster Plus, the Economic Evaluations database from York University, and many others. There were also hand searches of several sources known to publish systematic reviews to develop the initial content, and 2 independent raters assessed all documents for eligibility, and this was based on whether or not they met specific eligibility for being a review or any of the other document types that are contained in health systems evidence, as well as their relevance to the extensive taxonomy of health systems arrangements. This taxonomy actually was developed out of the WHO building blocks, but expanded and reorganized slightly to fit within governance, financial delivery arrangements, and implementation strategies, and also several categories were added. All of the documents were then quality appraised, and there were systems established to ensure the process was continued as well as feasible. So now we have a team of anywhere between 10 and 20 people at a given time that are constantly working to update the content, as well as make sure that all of the value-added content is there for all of the included records as well. So now we're doing mostly maintenance and updating content with this team, and this includes weekly searches of the database of abstracts and reviews of effects while it still exists, as well as McMaster Plus, monthly and sometimes more frequent searches of Cochrane because they do now a rolling admission of new articles, as well as constant hand searches of several listservs, websites, etc. that we know publish flags about new systematic reviews being produced or new documents being produced that will be of relevance to the database. So overall, what does this mean? I think health systems evidence is helpful because it can save you time by helping you rapidly identify the full range of research evidence about priority health systems questions. And the main intention of the database was to have everything in one place to facilitate this. By organizing all of the content by priority topics or specific domains, as well as health systems arrangements, it quickly allows you, if you're using the advanced search functionality, to zero in on those topics that are specific to your interests and to determine whether or not something is relevant or whether or not the search exists on that topic or not. It also enhances communication because we present things in many different formats. So currently there are over 10,000 documents in total in the database, and this includes over 3,200 systematic reviews of effects and almost 800 reviews addressing other types of questions. So we're constantly adding to all of these categories, but I thought I'd highlight for the Cochrane crowd the types of reviews that we currently contain in the database. The other 3 portals which I mentioned earlier are also growing. So currently we have in the Canadian-specific Evidence-Informed Healthcare Renewal Portal over 1,100 documents. In the Ontario-specific portal, almost 450. And also thought it's interesting to mention that we have nearly 10,000 registered users, of which 2,208 identify as policymakers. Another 2,244 identify themselves as healthcare professionals, and over 1,100 identify themselves as healthcare managers. So there are not just researchers using this resource, it's a range of other people that are interested in health systems and health systems evidence that are using this. So we have a lot of diverse users and many different types of users. So now jumping to how to use health systems evidence, which I wanted to focus the bulk of today on, specifically because I'm constantly getting approached at conferences and during meetings about some of the challenges people are having, but also just asking questions about how do you do a search more effectively in this domain. And oftentimes I'm finding that it's not that the system isn't useful in that way, it's just that sometimes people just aren't aware of the different functions we have within the database, specifically with the different advanced search functions. So I'll get to that. It is a registration system, and we do this because it enables you to sign up for a monthly evidence service. It also enables you to flag complementary content that you're interested in getting your hands on. If you're outside of Ontario or outside of Canada, you need to actually flag that you're interested in enabling the EIHR and OHSD portals. It also allows you to save your searches if you have an account. But importantly, on our end, it allows us to see how people are using the database and also to adjust the content and adjust the features so that it's more accurately suited to the needs of our users. So when you go to the registration page, it's quite simple. This is accessed through www.healthsystemsevidence.org. And you'll find that the registration is quite similar to what you've probably seen in the past with other databases. We ask for an email, password, your language, the country in which you're situated or working, as well as your role, and you can click all that apply. And again, we ask for just to prove that you're human, a CAPTCHA at the bottom of the screen. Once you're registered, this is where things get more tailored towards your own preferences. Specifically, you can choose the health system topics that you're particularly interested in. So if your policy file is focused mostly on financing, you can choose off any of the financial arrangements that you're interested in. If you're more focused on the delivery end of things, similarly, you can choose the topics that are most relevant to you. You can also choose within priority domains, so whether or not it's focused on primary care or long-term care, you can choose those as domains of interest. And any of the other document types contained in the additional 3 portals I mentioned, you can choose those as priority document types as well. As I mentioned, most people here in Canada won't have to worry about this because it will automatically be identified once you're logging in from a Canadian IP address. But here you would use the complementary content check boxes to identify that you're interested in if you're outside the country. If you're interested in using the range of document types and topic areas that you flagged here to generate specific content for you each month based on our updates, then you'd need to click down here on the yes to generate an evidence service each month. And what this does is, once we identify all of the new relevant documents which are going into our monthly update, only those that address your topics of interest will be sent to your email inbox. So you can quickly identify those that are of most relevance to you. So as I mentioned before, searches can be conducted using the landing open search page, and this is the easiest option, but not always the most comprehensive. What it does is it uses the keywords you enter to match specifically in the title. So any synonyms aren't flagged, so if you're using user fees rather than cost sharing, you wouldn't get anything on cost sharing if that's what your interest was in. But it does get you very relevant matches very quickly. If you know what you're looking for, so if you know that you're only interested in reviews, for example, or other documents focused on user fees, which can also be referred to as cost sharing in different countries, then using the advanced search is extremely efficient but also much more comprehensive. And I'll show everyone how to do that in a bit. So as I've mentioned, using the advanced search quickly enables you to zero in on the best available evidence by limiting based on health system topics. You can also limit based on types of documents, so whether you're only focused on systematic reviews of effects, if you're trying to work up the benefits of options, or if you're only interested in identifying economic evaluations, if you want to know the cost of particular options, you can quickly narrow down your search based on document types. As I mentioned a few times already, you can limit your searches by domains. You can also limit your searches by countries. And if you're situated in a low and middle income country, which some people who are using the database are, they only want records that are relevant to low and middle income countries. They can also filter by this category. And what I think is the most powerful characteristic is that you can combine all of these limits with open search keywords in the advanced search page. So I'll show everyone how that works in a second. And as I mentioned, there are many ways in which you can view the different results, but all of this information is provided to you on the search results page. So you get the title, the document type, the last year's literature search for reviews or published for other types of documents, the quality of the documents, the countries in which studies were conducted, and all available user-friendly summaries if you only have 5 minutes to read through the main results, as well as any free full text if you want access to that. So poll question 3, I'd like to know, and this is something that pops up when I have conversations with people a lot of people seem very comfortable with a Google-style open search, whereas others understand that you're only getting specific results using that approach. I'd like to know, when using health systems evidence, would you prefer to use an advanced search, being able to combine specific topics with keywords, or are you more comfortable using the Google-style open search? Great, so it looks like I've convinced most people that the advanced search is great, which could mean two things. It could mean that a lot of people here are research-minded and willing to roll up their sleeves and take a little bit of extra time to learn how the advanced search works. I do, however, think that a Google-style open search is helpful for people who aren't used to the advanced search and want to quickly find out whether or not there are documents on particular topics. So now we get into the demo. I'm using two scenarios today based on one particular problem which has been identified in a project that we had of not everyone in Canada having access to a primary care physician. And so scenario 1 that I'm going to be using to run the searches and show you how to use health systems evidence, make-believe, of course, is that members of a parliamentary committee on strengthening primary care have come to an agreement that the supply of GPs is inadequate to meet population demand, and they're considering one of the two potential options. So they've come to an agreement that option 2 is the one they want to go with. And this is shifting responsibility for primary care tasks to nurse practitioners. So we don't have a lot of doctors, but there are increasingly more nurse practitioners. So let's shift some of the care to nurse practitioners, and hopefully everyone will have access to primary care that way. So when we're doing searches, we might want to know about a number of things, which is why all of the different document types are contained in health systems evidence. So we might want to know about the benefits and potential harms of this option. So we might be looking for systematic reviews of effects or systematic reviews addressing other types of questions. We might want to know about costs, where we'd look for economic evaluations. We might want to know what adaptations need to be made when we're implementing this option. So we might look at qualitative reviews or process evaluations that have been taking place about particular options to see what types of things mattered in the rollout of an option. We also might want to know which stakeholders' views and experiences influence the acceptability of our options. So again, we'd be looking here for systematic reviews addressing other questions, systematic reviews that talk about stakeholders' views and experiences with task shifting from GPs to nurse practitioners. So when you go to Health Systems Evidence, hopefully you've registered and you've saved your login information with the browser. And if you've done so, when you go to the page, you type in your email and your password should automatically appear. And so for this search, you have a number of options. So I'm showing you here the quick fix. This is the open Google search by typing simply nurse. So you have no information put in here about the option you're considering. It's more of a content focus. You know that you're thinking about nurses in some way. It's very broad. But it still gets you some relevant records. So there's 213 that are retrieved overall. When we look at systematic reviews of effects in this instance, there are 71. So 71, not necessarily a lot of results to read through all the titles, but it is something that you may need some time to read through and digest what you've seen. In this particular instance, I found two that seemed to be somewhat relevant to my question at least, but I did have to scroll down quite a bit to get to those. Another option for the same search would be to get a little bit more sophisticated. You know which option you're considering, you know it's shifting care from GPs to nurses, and you know that it's in primary care. So you might want to go to the advanced search and find out if there are any combinations of search terms and limits that you can use to more effectively get what you need quicker. And so this is a little bit of a caveat for everyone here. The more you use this taxonomy, the more intuitive it becomes. I do suggest that you get a little bit of practice with it to see which categories are available. There might be something that you don't think is available, but it is. You just need to explore a bit, expand some of the categories and look around to see what's there. In our case, for this particular scenario, we do have a taxonomy category that discusses task shifting or substitution directly. So in this case, in the advanced search, I'd be clicking off this category. I'd then scroll down, which I can't show because I'm using screenshots, and expand the open search that's available on the advanced search page. I'd then use my nurse using the Boolean asterisk, so it's the wildcard that makes sure I'm getting nurse, nurses, nursing, and I'm searching only in the title field combined with this particular policy option, so task shifting. And because I'm really focused at this point on the benefits of this option, I only want systematic reviews of effects to be identified, and so I can click off that as well. And you can see that by doing just these 3 simple steps, I've been able to narrow my results down by half overall, and then within reviews of effects, also about half. So it's limiting the amount of reading of titles and abstracts you have to do just by knowing what you're looking for and knowing how to use the advanced search functionality to find what you're looking for. And a bit of scrolling as well, but again, I only had to read through about half of the titles to get to this one. And I found one pretty high quality review based on the AmStar score, 11 out of 8, 8 out of 11, and it seems directly relevant to the question. So substitution of doctors by nurses in primary care. You may have noticed on the previous screen that there was also the general versus specific tab. So general tabs are generally useful for those who want to know about the intervention in general terms. So primary care is a sector, but it's not focused on a specific disease in primary care, not focused on a specific group of patients in primary care. So you can limit your searches by having a more general focus as well. And by doing this, you limit your searches further. And in this case, only 6, so I got rid of 32 of the last searches. And my results came up in the top 2 by limiting by general. I'd also like to highlight for people that once you find something you're interested in, all of the value-added content that I mentioned before can be found by pressing the Show Links tab, which will become Hide Links because, as you can see in this picture, everything has been expanded. So by expanding this, you quickly get access to any user-friendly summaries that have been prepared. In this case, there's a Cochrane summary, a DARE summary, and an RX for Change summary. If you're interested in the more nitty-gritty details of that particular document, you can go to PubMed or Cochrane for the scientific abstract. And if you're only interested in the studies that are relevant to your own setting, so in this case it would be Canada, you can also quickly pull up all of the included studies that were prepared in Canada. You're also able to link out to similar documents. So now that I've found a review that seems to talk to the benefits of the option I'm considering, you might also want to know the costs, as I mentioned earlier. And so by clicking on the related documents for economic evaluations, you'd be pulling up all of the related documents focused on costs of the same type of option. And just another caveat, I'd like to say that we're currently revising the algorithm that's using to generate these results, so bear with us as we improve this feature. For the same topic, we might also want to know about views and experiences with task shifting from doctors to nurses. And so you can choose return to current search. I'll actually go back a slide. Oh, sorry. You can go back to the current search and choose systematic reviews addressing other questions, which will get you those qualitative reviews. And in this case, there are 9 that are available. And in particular, I found another review here, not as high quality, but the MSTAR tool was developed for systematic reviews of effects more, so it could be expected that the quality is a bit lower in this case. But it seems to be a review that's directly relevant to my topic of interest. Once you click on the title, you'll also be brought to a one-page summary of this document, which you could print off if you're interested in sharing with colleagues, for example. And it provides you with a range of information and all of the same benefits that you'd get by pressing show link. So it's about the same, provides you with a little bit more information, including the citation, for example, but a one-page summary of that document. If you're interested in learning about the health system in which some of the studies were conducted, so in the last slide you may have seen that the UK had several studies that were included in that review, that qualitative review about nurses, but we don't know much about the UK health system. So if you look, I'll go back a slide. In this case, you can see that the arrows pointed to read about the health systems where included studies were conducted. By clicking on this, you'll quickly be given access to the range of health system descriptions that can help you think through how their health system is organized in order to make assessments of the relevance in your own context. So the second type of demo I want to show is a similar scenario, although in this case, after reconsidering why there seems to be poor access to GPs in Ontario, the Parliamentary Committee considered that they got the problem wrong in the first case, and that may actually relate to how doctors are paid. And they come to the realization that remuneration mechanisms, in particular fee-for-service, have resulted in the maldistribution of doctors. So they consider a new option. And in this case, they want to know what's known about the option of switching from fee-for-service to capitation. And again, I jumped directly to the advanced search because with a little bit of experience using this, you'll know that there are categories in the financial arrangements that focus on fee-for-service and capitation, so you can quickly zero in on only the reviews that exist about those two topics. And because you're only interested in primary care and you're only interested specifically in how we're paying doctors, in the domain limits, you'll find that you can limit by sector, as I mentioned a few times earlier, and this is scrolled down on the advanced search page as well as particular providers you're interested in. So you'll see here that I focused in on primary care, physicians. Earlier up, I chose fee-for-service and capitation, and I want to know about the effects of this option. So I've clicked off systematic reviews of effects. By zeroing in this case, I was able to quickly identify 14 reviews of interest. And by doing a bit of scrolling of these 14, again, 14 isn't much to read through, I was able to find a review that seemed high quality and relevant to my question. So a few of the last slides I wanted to bring up for people are making the most of your searches. So I think it's really important to remember to try and combine taxonomy limits with keywords for more powerful, and I use powerful synonymously with specific in this case search. As I mentioned before, it requires a bit of practice with the taxonomy, but I think that the rewards are actually justify the time required to do a little bit of exploring. It won't take that much time, specifically if you're only interested in one or two interventions or options that you deal with on a regular basis. Again, most people, once I show them the drop-down of the taxonomy categories, they tend to think, oh my god, I didn't know that existed before, and really find it helpful. So I would suggest that just taking 5 to 10 minutes to become familiar with the taxonomy categories. So again, in this case, another example is if you're interested in emergency department wait times, if you did a little bit of exploring with the taxonomy category, you can see that there is a category under delivery arrangements called timely access to care. And when you combine that with a very specific title search of emergency departments, you can quickly narrow down your searches to those which are only the most relevant. And in this case, I was able to find a review quite quickly that addressed wait times in emergency departments. I also want to flag to people that once you become familiar with the database, you get used to using the taxonomy categories, and you find an approach that seems to be generating results that are relevant to your work on a regular basis. It's very helpful to save these searches so you don't have to remember what you used in the past. And this can be achieved by, once you identify a search strategy that works, by looking through the titles that are retrieved. At the top of the screen, you can see that there is a button called Save Search Criteria, and by clicking on it, a box pops up and you're allowed to name the search. So in this case, I name the search Emergency Wait Times. And by clicking Save in this instance, I'll be able to view my saved searches and run this exact same search from anytime I want to. So for example, if you're not signed up for a monthly evidence service, which I think you should be, and you want to rerun the search once a month to see what new stuff is in there, if at all available based on your particular interest, you can just pull up your saved search and rerun it. And again, I wanted to flag for everyone, again, that the Google-style open searches will get you relevant hits based on title and abstract keywords. And again, this will mostly be generating hits based on perfect matches in the title. So it will get you things that seem relevant, but it won't always be the most comprehensive results. So I'd like to highlight for people, again, the usefulness of using the advanced search functionality. I also make myself available, and my colleague FP Gauvin also makes himself available to answer any questions you have when running searches in health systems evidence. If you have issues understanding particular taxonomy categories, or if you're not generating search results that seem relevant, even though you know there are documents in the database that would be relevant to your particular questions. So feel free to email us at any time at hsc@mcmaster.ca for any of these specific types of queries. For today's presentation and for the development of the database as a whole, I'd like to thank the Program on Policy Decision Making here at McMaster, as well as Cochrane Canada and its Policy Liaison Office, McMaster Plus, and RX for Change. And here's some contact information, as well as the email address I've already mentioned. I'd like to encourage everyone to follow Health Systems Evidence on Twitter, whether in French or English. You'll get tweets about the newest hot docs that are added each month. And also like to flag for people to join us next week. Dr. Mike Evans is presenting at the McMaster Innovation Park as part of the LaBarge Optimal Aging Initiative, and he'll be focusing on how to fail well in patient engagement. And this is next Monday at McMaster, the McMaster Innovation Park, from 7 to 8:30 p.m. It's a free event. There's free public parking, and you can also log in via the web to watch this presentation. There are also several other public talks which are coming up, all freely available, all available online as well if you're interested. November 11th, Sir Mira Gray will be presenting. On the 25th of November, Graham Ellis will be presenting. On the 8th of December, Janice Keefe will be presenting. And the 9th of December, Richard Schultz will be presenting. And you can see here that there's a range of topics that may be of interest to you. And I'll just keep this up for now and open up the room to specific questions anyone had about the database, about the search functionality, any questions people had about the background, the development, the process we use each month to update content, or any other questions you may have.
Thank you very much, Kaelan, for presenting today on health systems evidence as to what it is, how to find it and save the information, as well as making yourself available for questions. Let's all send Kaelan a round of applause first before we get on to the questions. I do see that we have some. We do have a time for questions, and we'd like you also to complete the evaluation. Now, I've tried to copy and paste the evaluation link, and I have not been successful, but if we don't, we will send it to you through the mail, and we would appreciate your input. And before we get onto the questions, as I mentioned, the evaluations, we will send you this link, and it is important to us to get feedback. And join us for next week's webinar, and as we mentioned, it is a series of 5 policy webinars. Sorry, next week, it's next month, November 20th, and it's at the same time from 12 until 1 on a rapid response program. You can read more about it on the Canadian Cochrane and Cochrane Canada Live webinars website if you wish to read about it as well as to register. And finally, I did want to mention that we are having a Cochrane Canada Symposium coming up. It's in Calgary in May, the 21st and 22nd, and we hope that you'll be able to join us there. Now, for questions, you can enter them in the bottom, or in fact, you can there, okay, or you can raise your hand. So let's get to the questions, see if there are any here. I saw a hand raised previously. So you can enter your questions in the chat room area, and I see Alicia has placed the link in for the evaluation.
And if there are no questions, it's completely fine. I think the most helpful thing I think people would do if they do have questions is just send the email to us after navigating their way through the advanced search. Specifically, if they highlight any difficulties they're having, we'll be more than happy to respond.
Okay, I do see somebody writing something in the comment area. And it is true, sometimes you do have to experiment a little bit, I think, with the website, and that's when the questions rise. Okay? Kate says, thank you all, what a great collaboration to put on these webinars. So a comment, not a question, but thank you very much. Okay, well, if there are no questions at this time, I'll let you go. And I want to thank everyone so much for joining us today. We really appreciate your time and participation. And thank you as well, Kaelan, for presenting today. And I'm sure that there will be follow-ups from this webinar with some questions.
My pleasure. Again, please feel free to email us at hsc@mcmaster.ca. We'll do our best to help you navigate your way through the advanced search function.